A dementia care review is a holistic approach to an individual's care. We could look at the medical side of it, but we could also look at the social side. Dementia care reviews tend to be quite a challenging one to approach. We find that some patients, relatives, they feel like they can do everything. And then when you break them barriers down a little bit, it turns out they need a lot more help.
A dementia review should ideally be where both the person with dementia and anybody who supports them is present. And it's also for the GP to kind of understand what's kind of going on within the family situation. So it's not just reviewing their medication, but it's also an opportunity to kind of bring up other things that might be affecting the person with dementia and anybody who's supporting them as well.
What we like to do is a medical review, obviously, so simple things like blood pressure. More importantly, it's also about seeing how the person is. How is your dementia affecting you? Do you feel a bit low sometimes? How are you managing with your normal activities? Are you struggling with your mobility? How's your sleep? All those sorts of things are really important to know about. And then on the more sort of social side of things, it's can you afford to pay for your heating? Are you struggling with money in any other way? Who do you live at home with? How is that person? Because it can be quite upsetting and stressful living with somebody who's got dementia if you're having to deliver more care for them.
My mum has got dementia. She's had it for about 10 years now, and for most of them years she lived at home with my dad. Before lockdown, my mum and dad used to come here to the Parsons Cross Forum, to the Memory Cafe, 3 times a week. They've got full lives and they were managing okay-ish at home. My mum sees the doctor fairly regularly anyway because of various little bits and bobs that are going off. But if them things weren't happening, definitely dementia patients need an annual review. Doctors need to see how much they've deteriorated, whether they've gone from being a client that just requires care to being a client that requires nursing care, and just to see what that person's circumstances are and whether the needs have changed.
People are aware that they come for medication reviews at the GP surgery. We're wanting to try and change that slightly and say that we're wanting to do a much more holistic review of their sense of well-being and where they are in their dementia journey, and hopefully to bring in care planning into that review. I think the most important part of a dementia care review is really the social aspect and also the carer aspect.
Basically what we're doing at the moment is we're trying to start doing dementia reviews in the community rather than just in GP practices or in clinical settings. And the reason behind that is so that we can see people in their own home, also that we can see people in places where there are extra services. For example, places like dementia cafes. These places are really good because not only do they provide something for the person with dementia, but also their carer or loved one.
So when I've been married for 56 years, and she started with memory problems in 2013. When we first started, we both enjoyed it because we used to meet people, and I was meeting people in the same boat as me. It was nice to talk to them, and Sue loved it because she liked to have a dance. Music, it's like a switch, and she comes alive, so she's gone back to her teenage years. I think it'd be a good idea to bring her into here. It's not just clinical. This place, it's home. If Sue were coming, she'd recognise it, and she'd be at ease. I know that by having that review, they're keeping tabs on her to see whether she's got any worse or any better. So to me, that is important. Dementia is a horrible disease. They call it the long goodbye, and it is. I've been saying goodbye.
I think the dementia care reviews could be used in a very positive way. It's an opportunity to make sure that people's needs are being met in that holistic sense. So hopefully people's lived experience should be better if we've addressed that for them. And that's where the advanced care planning comes in as well. To prevent a deterioration or prevent a crisis is in everybody's best interest, the person, the carer and the GP and the health service as a whole.